tell me what happened to your elbow.
I was training in Muay Thai, and I was in a clinch with somebody, and they twisted my arm to get out of the clinch.
Okay, so I'm like this clinching.
So it's like
that.
Yes.
So you're forcefully, did your arm go straight or bend?
It went backwards like that.
Okay,
Yeah.
okay. So you had pain right away?
Right away, yeah. But I kept going. I finished training, and the next morning I definitely felt a lot of pain. It was very stiff, actually. I couldn't put my hair up. I was having difficulties doing a lot of things, but I iced it, and it seemed to have the pain dissipated for a little bit, but it's still persistent, and it's been over a week now.
I can see you're icing it.
I'm icing it. Yeah.
Did it swell?
Not so much. There was a bruising, but minimal swelling.
Okay, and you said it felt stiff, so you lost
Very
some of your motion?
Yes, like I went to tie my hair and I couldn't like do this with my hand. I tried to do this to tie my hair and I couldn't really do it.
Okay.
Yeah.
Where exactly do you feel the pain in?
It's in this area. It's right there.
Any numbness or tingling in your baby finger?
No.
Okay. I ask that because there's a nerve that's really close, and sometimes if that gets irritated, you can get numbness and tingling.
I see.
Let me do a little physical examination. Can you bend your arms up and touch your shoulders? Yeah, good. Does that hurt?
Tightness.
Okay.
Yeah, I can.
Straighten out again. Good. Bend your elbows to 90 and then drop your hands down to the floor. Good. And just relax. So I'm looking to see if there's any evidence of swelling, and I'm going to look at this elbow too. And they're basically the same. When we're looking for swelling in the elbow, there's a little dimple that you'll see right here, and if there is joint swelling, we'll see a big puffy spot there, and you don't have that. You do have a little bruise right there.
Yes.
From
training, yeah.
From training. Okay, so usually I go to the spot that I think is going to hurt last. So you let me know if anything is tender.
Okay.
I'm feeling along the bones, the tendon. You okay in there?
Yeah.
There's no swelling, that I don't feel any swelling. Now what I'm thinking about, just from your history, it's whether there's a ligament that's on the inside of the elbow, and then there's a tendon. And so, is that tender? So that I'm feeling the muscle, and I'm getting up to the tendon, and she's starting to raise her eyes, she's thinking about it. But that's the ligament, right?
It's, yeah.
Right there's
Right
the
there.
ligament.
Yeah.
So I'm a little concerned that it could be the ligament that's been stretched a bit.
Okay.
So what I'm going to do now is just put a little stress on the ligament
Okay.
and just relax.
Okay.
And then you just tell me if it hurts. So I'm going to, does that hurt to do?
No.
Good. Does that hurt to do?
No.
Good. So that's really good, because when I applied pressure to the ligament itself, it didn't hurt you. I want you to curl your wrist up like this. Don't let me move your hand. Hold it there.
Okay.
Is that painful?
Not painful, but I do feel something
Interesting.
right there.
Okay, good. Wrist back. Like
this.
Yeah. Don't let me move it. Any pain? So, okay, so you're going to put your wrist like so. Hold it there. Keep it there. Don't let me move it. Any pain?
No.
Interesting. Okay, so what I'm going to do is I'm stabilizing the upper part of your arm, and now I'm going to stress the ligament a bit more.
Sure.
Does that hurt when I just do that?
No.
And then if I put your palm down, I do this, it doesn't hurt?
No.
Good. And then if I take your thumb, and now I'm going to move through a range. Does that hurt?
No.
Good. Okay, well I would say, you can sit up.
Okay.
I would say that what's happened here is that you've strained the muscle, right? Do you want to sit with your legs over your arm? So there's a muscle that's on the inside of the, let me put that down. I went up. So there's a muscle and a tendon on the inside of your elbow, and I think what's happened is that you've strained this muscle tendon unit.
Right.
And the reason I say that is that have pain when we resist the movement that muscle and tendon does.
Yes.
And I don't think it's the ligament, because when I stressed the ligament, you didn't have the pain. So
Right.
that's good news.
That's good.
So, and now it's a week and a half later, and when I feel the area, I don't feel a lot of swelling or edema within the tissue, but it's definitely irritated. So what happens now is that this muscle is not going to be working properly.
Right.
And so what you need, and you've done a really good job of getting your range, like you've got your full range of motion in the elbow, so that's fantastic. And let's just see the flexibility of your wrist on the other side. I'm just gonna
Come here.
come over here and just bend your arm. Just bend your arm. You're pretty similar. So, you know, your flexibility is pretty good, which I'm really happy about. So I think what you need to do is you need to start just wakening this muscle up. And you're gonna do it by, you can really bend these three fingers, the little three fingers.
Yeah.
You can squeeze, okay?
So squeeze as in I'm squeezing into
Making
a
a fist.
I
Yes.
see.
Do you feel it when you do that? Does it hurt when you do that?
Doesn't hurt.
Good. And now do it with your arm straight.
A little bit.
Okay, so
Yeah.
what happens is that when you stretch the muscle a little bit that crosses the elbow,
Right.
that has put a little more stress on the muscle and tendon. So by changing the position of your arm, you're stressing the muscle differently. So you do it with your arm bent.
Right.
And then you're gonna work your way, not moving yet, but you'll start with your arm bent, you'll do it, then you'll straighten your arm a bit, do it again, straighten your arm, do it again, straighten your arm, do it again. And I want you to do this throughout the day. Because what it'll do is it'll kind of waken the muscle up, and it helps with the healing tissue. It gives the healing tissue some direction, so that you don't end up with a blob of scar tissue that's disorganized. When you're moving and you're activating the muscle, it tells the body how it needs to heal. And once you can do that without pain, then you can start to get a rubber band, an elastic band. You can stand on the band and hold it, and then you're going to slowly lower, and you're going to bend. And you're going to start out with your elbow bent initially, and then you'll do it with your elbow bent, moving your wrist, or sorry, your elbow straight, moving your wrist, so that you're stressing the muscle again with your elbow in different positions.
Like a resistance band.
A resistance band.
Oh, okay.
Like a very light resistance band. And then we're going to check in 2 weeks, and we're going to see how you're doing and give you some more exercises to do.
Sounds good.
And in the meantime, now you can do anything that doesn't cause pain or swelling.
Okay. All right.